Hello, everyone. My name is Sarah Archit. This is the second portion of the presentation regarding binge eating disorder. So just to get started, the article that I chose is called "The Rate and Shape of Change in Binge Eating Episodes and Weight, an Effectiveness Trial of Emotionally Focused Group Therapy for Binge Eating Disorder." So basically, as you can see, this study investigated the changes between binge eating episodes and weight over 20 weeks in an emotionally focused group therapy and combined therapy with dietary counseling. About 118 obese adult patients with binge eating disorder participated, they were previously treated by other therapy protocols. During this time, the patients were assessed weekly during 20 weeks of therapy. Based on the clinician's consensus, participants were either assigned to the emotionally focused group therapy or combined therapy. Just to give you what the difference is between emotionally focused group therapy and combined therapy. As you can see, according to the author, it's stating emotionally focused group therapy is aimed at helping clients to change the way in which they experience and use their emotions. And also, according to the author, combined therapy is using EFGT, emotionally focused group therapy, combined with dietary counseling to lower energy dense food intake. So basically, the EFGT is focusing more on building relationship with and regulation of the patient's emotions in order to help the patient manage and overcome the fear associated with social situations, whereas this is what comes with the binge eating. And the combined therapy is basically stating that having the emotional focus group therapy, but using dietary counseling in it. So to not get you confused, there was two separate groups in this study. So one was just using the EFGT, and the other was using combined therapy, EFGT, and dietary counseling. Okay. Oops, sorry. So basically, a patient's weight was measured using a medical beam scale during the study. Severity of binge eating episodes is associated with weight gain. According to the author, emotional eating scale was given to each patient to complete that asked them to rate their urges to eat to evaluate if their emotions precede the urge to eat. So this evaluation is basically a scale given to the patients to see where they are with the urge to eat. If the therapy is helping or the dietary counseling is helping, this gives the researchers a way to find out what's going on. The results indicated that binge eating and weight declined during the emotionally focused group therapy and combined therapy, but the combined therapy had more of a rapid weight loss during weeks of therapy than the emotionally focused group therapy. So, because the combined therapy had the dietary counseling intact in it and the EFGT didn't, so you can pretty much figure out why there was more of a rapid weight loss with the CT as opposed to the EFGT. The researchers did mention that most psychological treatments are not effective for weight loss, but that they do suggest that the emotionally focused group therapy and combined therapy are good options for treatment. Okay. The web resources that I looked up are, first one is Binge Eating Disorder Association. As you can see, it's www.bedaonline.com. This site was founded in 2008. It's a national organization that's focused on providing leadership, recognition, prevention, and treatment of the binge eating disorder. So basically, they provide, if you want to find counseling or support groups or any kind of conferences maybe that they're having, this is a perfect website to go to. The next one is the National Eating Disorders. This specifically deals with all the eating disorders, but I went to the specific website for binge eating disorder. This provides like facts, statistics, and again, information on treatment in the area, in your area that you may want to find if you have a client who is suffering from this disorder or any other eating disorder. You can check out this website. Overeaters Anonymous is an excellent website. It's basically gives information about support groups, not just for binge eating, but for compulsive overeating, undereating, food addiction, anorexia, bulimia, binge eating, or over-exercising. So this is like completely anonymous. If you do go to a meeting, it's just like AA or NA, like no one knows you that when you go there. So this would be a great resource for someone who is suffering from an eating disorder of any kind. Alrighty, and that is my article and web resources. So thank you.